Ready? Thank you for waiting. Today is, I don't even know, Thursday, April 2nd. We're in the Finance Committee. We're going to have a long voting session, and I'm going to turn the meeting over to Nathan.
Thank you, Madam Chair. So, members, we're going to be starting today with the pink voting list. That's voting list number 20 that has my name on it. I'll also note that there are 4 Senate bills that are back before the committee on concurrence. That's shown on the blue sheet, but those bills all relate to House bills that are on a voting list today. So those concurrences are going to be mixed in at the appropriate time to address them right after the House bills. So with that, I'll start at the top of the pink sheet with Senate Bill 246. So Senate Bill 246, which this committee heard back on January 27th, specifies that at the end of a term, a member of the Health Services Cost Review Commission, HSCRC, may continue to serve for up to 6 months rather than until a successor is appointed or qualifies. Additionally, a member who is appointed after a term has begun may serve only for the rest of the term. There are no amendments and no fiscal impact.
Do I have a motion? Thank you, Senator Jackson. Do I have a second? Senator Reedy. All in favor of Senate Bill 246? Thank you.
Up next is Senate Bill 370, which, as amended and shown in the reprint before you, updates the name of the Accreditation Commission for Acupuncture and Herbal Medicine. The bill further requires the State Acupuncture Board on renewal of a license to make available proof of renewal to each licensee rather than issuing a renewal certificate. The bill also prohibits a person from employing an individual to practice acupuncture without a license or aiding or abetting the unauthorized practice of acupuncture and establishes penalties for a violation. The amendment strikes from the bill language that would have defined manual therapies and altered the definition of practice acupuncture, removing concerns related to acupressure, which the committee heard at the bill hearing. These amendments will align Senate Bill 370 with the cross-filed House bill, which is up next on the list.
Okay. Do I have a motion for the acupuncture revisions bill? Second. Senator Lamb, Senator Guile.
With amendments, Tammy.
I'm sorry.
With amendments, I was commenting to clarify.
With amendments, Senate Bill 370 and House Bill 374 with amendments.
House Bill 374 is unamended. It would be clean.
Okay.
If you want to take them up at the same time.
We'll take them at the same time. So we amended the Senate bill to reflect the changes in the House bill.
Yes, ma'am.
So now they're in the same posture. Okay. So we have Senator Lamb and Senator Guile all in favor of the acupuncture bills. It's a unanimous vote. Thank you.
Okay, so skipping over then House Bill 374, which you just moved favorably and in the same posture as the Senate bill. Next then is House Bill 372, which is identical to Senate Bill 169, which passed the Senate earlier this session. The bill generally codifies the Federal Emergency Medical Treatment and Labor Act, or EMTALA, provisions into state law with respect to pregnancy-related medical conditions. There are no amendments and there's no fiscal impact.
Senator Lamb, can I have a second? Second. Senator Guile, all in favor of House Bill 372 with no amendments. We need to call roll, Tammy.
House Bill 372, favorable. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Mounts.
No.
No. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes.
Yes. Senator Guile.
Yes.
Yes. Senator Lamb.
Yes.
Yes. Madam Chair.
Yes.
Yes. 7-2. Is that right? 7-2.
7-2, bill passes.
Passes.
Okay.
Up next is House Bill 446, which is nearly identical to Senate Bill 555, which passed the Senate unanimously earlier this session. The difference between the bills is stylistic only and not substantive. And there are no amendments on the House bill. The bill establishes the Dementia Services and Brain Health Program in the Department of Health. And so again, there are no amendments.
So what will we do to make it the same as the Senate bill?
You don't need to do anything. The Senate bill passed the Senate unanimously and was heard over in the House today. Senator Hayes, I spoke to your aide who expressed the desire for the House to conform the Senate bill with the House bill.
Okay, good. Okay, so we have a motion on House Bill 446. Okay, Senator Mounts. I got Senator Hayes. Okay. All in favor of House Bill 446? Unanimous vote. Thank you.
Up next is House Bill 637, which is identical to Senate Bill 385, which passed the Senate earlier this session. The bill requires the Secretary of Health to issue, publish, and distribute specified recommendations for immunizations, screenings, and preventative services. There are no amendments. There is no fiscal impact.
Okay. Lamb and Hayes, I think we need to call the roll.
House Bill 637, favorable. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No, and just like last time, one of the problems with this bill is it puts special interest groups in as at the same level as the FDA and federal authorities. So it's a no from me.
Senator Mounts. No. Senator Jackson.
Yes.
Yes. Senator Washington. Yes. Senator Guile. Yes. Senator Lamb. Yes. Madam Chair.
Yes.
Yes. 7-2, bill passes.
Up next is House Bill 671, which is identical to Senate Bill 340, which passed the Senate unanimously earlier this session. The bill requires the governor, beginning in fiscal 2027, to include in the annual budget an appropriation of at least $2 million to support the Office of the Long-Term Care Ombudsman in the Department of Aging. There are no amendments.
Thank you, Senator Lamb. Second?
I'll second.
And Senator Kramer. Can we do all in favor of Senate Bill, House Bill 769? Is it as amended?
671
I'm sorry,
favorable, no
671.
amendments.
I was down one. Okay, 671. Thank you.
Yes. This is
That's
one-
all.
Well, and up next is House Bill 769, which, as amended and shown in the reprint, with one exception related to the due date of a required report, this bill, as amended, is identical to Senate Bill 18, which passed the Senate unanimously earlier this session. And so I'll note that Senate Bill 18 is back on concurrence from the House with amendments. And so what the committee decides here will impact the next action that the committee takes on the concurrence on Senate Bill 18.
What's the amendment?
So there are three amendments to the House bill. And they align the House bill with the Senate bill, except that it pushes back the due date of a report by 1 year from 2026 to 2027. The three changes that are being made to the House bill to align it with the Senate bill are: one, prohibiting the renewal of a provisional license. The Finance Committee passed the bill authorizing this provisional license to be issued for 12 to 24 months. The House added a provision that allowed for a renewal of up to 24 months. So the provisional license would then last a total of 4 years. The amendment strikes that renewal, keeping it to the 12 to 24 months as the Senate passed it. The other change that the House made would have authorized the supervised hours under the provisional license to count towards the number of hours required to receive the LCSWC, the clinical social worker license. The amendments return that prohibition. The hours may be counted towards the independent practice certification, but not towards the LCSWC license. And then finally, the amendments to the House bill here strike an element to the annual report.
So if we pass this, they'll be in the same posture.
Substantially. The only difference between what would come out of the Finance Committee with this House bill with these amendments would be that the report that you can see on page
the
4 of 7
27,
will
okay.
be back to 2027 instead of in 2026. That sort of makes sense because the board, under the bill, is only required to start issuing these licenses in November 1st of 2026. And so to require an annual report on December 31st of 2026 seemed like too short of a time period. So moving the report back to 2027 was something that didn't need to be corrected in the House bill.
Okay.
Move favorable with amendment.
Senator Hayes, and who wants to second?
Second.
Senator, all in favor of House Bill 769 as amended? Thank you.
Okay, up next before the committee then is the first concurrence of the year. So Senate Bill 18, which is the cross-file to the bill that the committee just voted on, includes amendments that were added in the House that do the things that the Finance Committee just removed from the House bill. And so that is, again, the House added amendments to Senate Bill 18, authorizing a renewal, pushing back the report by 1 year, allowing the hours to count towards LCSWC, and then adding an element to the annual report. So in this circumstance, a motion to not concur would be appropriate.
So move.
Senator Hayes.
And this would be the bill sponsored by the minority party that would cost taxpayers $250 to $500
Not yet, we're not there yet.
billion. That's not. We're on social. That's the
We're on the
next.
Senate bill, yeah, we're on the Senate version of.
Yeah, so this is not reflected on your pink sheet. This is reflected on the blue concurrence sheet.
Okay, Senator Mount seconded. All in favor of the
Motion to
non-concurrence?
non-concur.
All in favor of the non-concurrence? Okay, we got it.
Okay, so then up next is House Bill 813, which, as amended and shown in the reprint, is identical to Senate Bill 496, which passed the Senate unanimously earlier this session. This is the bill that authorizes Medicaid beginning January 1 of 2027 to provide comprehensive coverage for the treatment of obesity, critically including GLP-1 medications. The amendments that are before you strike a provision requiring the Department of Health to apply to the Federal Centers for Medicare and Medicaid Services for a certain state plan amendment. That change will eliminate the fiscal note and align the House bill with the Senate bill that, again, passed unanimously earlier this session.
What's the bill number you just talked about?
We're talking about House Bill 813 right now.
You can move favorable with amendments, right? Favorable with amendments.
Madam Chair,
Yes.
I just wanted to confirm, this is that bill sponsored by a member of the minority party that would create a $250 to $500 million with a B dollar a year fiscal note for the taxpayers of the state of Maryland. Is that, Nathan, is that this bill?
I want to be very careful in the response. So the bill that passed the Senate and this bill as amended do not require the Department of Health to offer this, speaking specifically the medication. But if they do, if it were to everyone who requested it, the fiscal impact could be in the hundreds of millions of dollars. However, I will also point out that the authorization under the bill includes a provision authorizing the department to utilize utilization review and has other mechanisms to potentially decrease uptake.
But Senator, we don't know what the long-term benefit is if we have healthier people that aren't having hypertension and heart attacks and diabetes because they have lost weight, and we don't know what the savings are. So it's
Kind of like the environment conversation today about those who might not have asthma and
sort of like that.
and respiratory diseases because of the great strides we've made there. Thank you, Madam Chair. I appreciate that. Good point.
Okay, so we had Senator Mount's motion. Do I have a second?
Yeah, second.
Senator Hayes. I think we need to call the roll.
Do we?
Is it unanimous?
Y'all aren't sticking with your boy?
I'm okay with repurposing money that's already being spent for prevention rather than afterwards, so I'm fine if it's the same money, which it is.
Senator Kramer, do I need to call the roll?
Oh, no, look, I believe in making an investment in the health and well-being of our residents, and that's what it is. And investment.
Okay, so it's a unanimous vote on the House bill with the Senate amendments. Thank you.
Great.
House Bill 1047.
House Bill 1047 is nearly identical to Senate Bill 915, which passed the Senate unanimously earlier this session. The bill requires an individual to register as a limited X-ray machine operator with the Board of Physicians to perform certain X-ray machine operations that previously could be performed without a license. The bill also recodifies provisions related to the delegation of duties by a physician to a registered cardiovascular invasive specialist or a supervised medical graduate. The Senate bill was amended to increase the required training hours for a limited X-ray machine operator. The House bill that is before you without any amendments keeps that number of hours the same as what is required in current law. So again, there are no amendments and there is no fiscal impact. The House will amend the Senate bill to retain the current number of didactic training hours.
I think Senator Mouse wants a motion. And who would like to second?
Second.
Senator Reedy. Okay. All in favor of House Bill 1047? Unanimous vote. Thank you. I'm counting you in, Senator Kramer.
Yes, ma'am.
Okay. Okay, House Bill 1135.
Yes, ma'am. And following House Bill 1135 will be a concurrence on the cross-filed Senate bill. So House Bill 1135, as amended and shown in the reprint, is identical to Senate Bill 773, which passed the Senate earlier this session. The bill authorizes a pharmacist to order a vaccine for an individual who is at least 3 years old without the pharmacist administering the vaccine. If a vaccination is administered to an individual younger than 18 or ordered for administration by an adult caregiver to an individual younger than 18, the pharmacist must inform the patient and the adult caregiver of the importance of visits with a pediatric primary care provider and then refer the patient to a pediatric primary care provider when appropriate. So the amendments strike provisions that were added in the House that did three things: limiting the bill to intranasal administration. That's on pages 1 and 2. It also strikes provisions changing, making changes to the parties authorized to administer the vaccination. That's on page 2. That's the change of adult caregiver to parent or guardian, and then in this case back to adult caregiver. And then finally, the amendments strike language that related to information to be reported to Immunet.
Senator?
So to concur is to strike.
This is not the concurrence. This is the House bill that is before the Finance Committee with amendments.
And you want
Next will be the Senate bill on concurrence. The Senate bill, I'll foreshadow, came back with these same amendments
Right.
applied to the Senate bill. So
Okay.
on the concurrence, the question would be whether the Finance Committee concurs or does not concur. To reject the concurrence would then set in motion a conference committee.
Okay. I think those are good amendments. It's myself, just speaking for myself. So I would be willing, I voted against the bill coming out of here. I'd be willing to vote for the bill with those amendments. I think those are good safeguards. So I would resist those amendments myself. I'm just going to say, I think was it a decision? What's the process by which these are amendments from, I assume, the chair on behalf of the committee?
Yes.
Okay. Well, despite my affection for our chair, I think I'm gonna say I oppose those amendments. I would rather us keep them, but so I think those are good safeguards.
Thank you, Senator. I just wondered if they don't have to report to Immunet, how do we have a record of the vaccines that have been received?
The amendment that is, sorry, the language that is being struck on page 3 of 4 does not does not result in a situation where it is not required to be reported to Immunet. So I'm happy to address that in specific detail.
I assumed that was not the case. That's
So
why-
on yes, so on page 3 of 4, the current law is clear that a pharmacist must report all vaccinations administered or ordered by the pharmacist. And so if the committee were to take the amendment offered by the chair today, it would strike a phrase saying, including the intended recipient of each vaccine ordered by the pharmacist. That language is not necessary. Immunet is a repository of information related to immunizations for an individual. And so it would not be appropriate to say that a pharmacist ordered a vaccine to a street address. The Immunet entry would be that it was ordered by the pharmacist for Mr. McCurdy at street address such and such.
So they wanted more information.
It's not more information. That information would already be included in the Immunet entry.
But what did their amendment do on that?
Their amendment simply added to the law the phrase, including the intended recipient of each
Oh, I
vaccination
see.
ordered by the
And I know why
pharmacist.
they're doing that, but I understand that's a little bit cumbersome. I mean, of these amendments, is there any way, even the intranasal, I like that amendment too, but if, I like the parent guardian one. I mean, is there a way to keep that, or?
Would you like me to discuss each of the amendments in turn? Please. Okay. So I'll just run through the reprint real quickly so that there's a discussion, a point of discussion for each one of them. So on page 1, in line 16, the amendments strike for intranasal administration. The reason for striking that and putting the bill back into the posture as it passed the Finance Committee is that if the FDA were to approve another vaccination in the future that relied on a different method of administration, then the General Assembly would have to come back and specifically add that to the list.
Okay,
Honestly, I'm just wanted to see, just trying to barter if you care whether I vote for it or not. You probably don't care, but I just was like, if we could preserve it to parent, I know you're right. If we could keep the parent and guardian one in there, that would be good, I think. I'm sure there's reasons why we don't want to do that. I think that's a good safeguard, so, yeah.
So, and since that's the last change, I can address that really quickly on page 2 of 4. So the House amendments in line 24 changed adult caregiver to a parent or guardian. The amendment before you would change it back to adult guardian. I would point out that in line 25, the same item still uses references to adult caregiver, and it would keep the provision internally consistent to refer to the adult caregiver. And I think that there was some discussion in the committee about situations where someone who was responsible for the child or asked to take the child to the pharmacy to have the vaccination ordered could be a grandparent who was not a guardian of the child. And so this would allow flexibility for families when a relative, for example, picks a child up from school, I think is the rationale that was discussed in the committee when a similar amendment was considered on the Senate bill.
Well, and if I can add, there are a lot of instances where family members are now helping with children because there's not a parent in the picture, but they're not necessarily a legal guardian. So I've run into issues in my business where a child could not get their driver's license because the grandparent didn't have legal guardianship. It doesn't mean they shouldn't get vaccinations. So I think that's why it's better to say adult caregiver. I'd like a motion for taking off the House amendments. Okay, Senator Lamb and Senator Guile. Thank you. Let's take a vote, Tammy.
The bill? So is it,
This would align it with the Senate version?
Yes,
Yes.
this would align it with the Senate version.
so does this make it just favorable?
Favorable with
Just
amendments.
It's still with amendments. We're removing amendments, so
You're
it's with
removing the
amendments.
House amendments, yes.
House Bill 1135, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
no,
No. Senator Mounts?
Yes.
Yes. Senator Jackson? Senator Washington? Yes. Senator Guile? Yes. Senator Lamb? Yes. Madam Chair?
Yes.
Yes. 7-1. Bill passes.
Thank you.
The next item is Senate, this is not on the pink sheet, it's on the blue sheet. This is a concurrence. Senate Bill 773 is back before the Finance Committee. This is the cross-file to the bill that you all just voted. The House added the amendments that the Finance Committee just struck from the House bill, so a motion to not concur would be appropriate.
May I have a motion to not concur on Senate Bill 773 that was amended? Senator Guile and Senator Lamb, will you second that? Thank you. All in favor of the not concurring? Okay. Unanimous vote.
House Bill 1470 is next on the list and last for me. This bill, as amended and shown in the reprint, is identical to Senate Bill 839, which passed the Senate unanimously earlier this session. The bill requires the Department of Health, beginning in 2026, to conduct an in-state cost of dispensing survey at least once every 3 years and report the results of the survey to the General Assembly. So the amendments strike provisions requiring the department to adopt regulations altering the dispensing fee based on the results of the survey and then establish the required report. I'll again emphasize that this aligns the House bill with the Senate bill that passed the Senate unanimously. So a motion favorable would be favorable with amendments.
Favorable on this
With amendments.
bipartisan
Yeah.
bill, favorable with amendments.
And
Thank
Senator
you.
Matt, Senator Reed. Favor of House Bill 1470. Unanimous vote, thank you. Okay. Lisa, as you start, I'm going to ask to hold the first two bills, which are the Senate Bill 546 and 410.
Okay.
There's been some discussion. I'd like to hold those two bills.
So then the first up would be Senate Bill 808. The cross-file of this bill is up next and has passed the House unanimously as amended. Senate Bill 808 as amended alters the process through which healthcare providers apply to participate on a carrier's provider panel. The bill repeals authorization for a carrier to charge an application fee and alters requirements relating to updating information in a provider directory. It also alters requirements associated with designating a provider credentialing application for an online credentialing system as the Uniform Credentialing Form and a multi-carrier common online provider directory information system for use by providers. This would put the bill in the same posture as the House cross-file.
Can I have a motion?
Be favorable with
Favorable
amendments.
on Senate Bill 808 with amendments?
Yes.
With amendments. Senate Bill 808 with amendments. Senator Guile, thank you. Do I have a second? Did I hear Senator Washington first?
No, I didn't say.
Okay. Senator Jackson. Okay. All in favor of Senate Bill 808 as amended? Unanimous vote. Thank you.
Okay, next is House Bill 1093, which is the cross-file of Senate Bill 808 that the committee just passed and is in the same posture as that bill. There are no amendments since the House already amended it.
Move favorable. Second.
All in favor of House Bill 1093? Unanimous vote. Thank you.
Okay.
You were the motion or the second? You were the motion. And who was the second?
Second was Senator Kramer.
Thank you. Okay.
Next is Senate Bill 900, which is
I'd like to hold 916 unless you have an amendment ready.
I have an amendment for Senate Bill 900 that aligns it with Senate Bill 1016 as it was passed.
Does it limit it only to architects?
No.
Okay.
Okay.
We have another amendment we're going to need.
Okay.
I thought they had that ready. We talked about it. Okay.
But I didn't ask you tonight, because I was supposed to.
No, I thought your concerned party was asking.
I thought so too, of course, they also said they talked to me in that, so,
I haven't heard anything about that amendment if it helps. Okay. So then I guess we're on to Senate Bill 982, which authorizes a mutual insurance holding company that directly or indirectly owns 100% of the capital stock of a reorganized stock insurer to convert its mutual insurance holding company system into a mutual insurer in accordance with a plan of conversion adopted and approved under the provisions set forth in the bill. There are no amendments, no fiscal impact, and no opposition at the committee hearing. The House bill has also passed the House unanimously in the same posture.
I have a motion for Senate Bill 982 and House Bill 1616.
Yeah, move in favor.
Senator Mounts, and who's a second? Senator Jackson. All in favor of those two bills that are in same posture? Oh, Senator Ellis joined us. Thank you, Senator Ellis. That gives us now 10 to 0. Thank you. Okay.
Okay, next is House Bill 226. The committee voted the Senate cross-file earlier this year, and the House had amended the bill some. This is a departmental bill that requires the Maryland Department of Disabilities to oversee and administer affordable and accessible housing program. The House's amendment said that the bill may not be construed to limit or restrict the authority of the Department of Disabilities or another authorized governmental entity to determine eligibility for any program, benefit, or service or make policy decisions. The House is amending the Senate cross-file to conform with this version of the House bill, so they should be in the same posture.
Okay, I have a motion for House Bill 226. And you said there were amendments that conformed it.
Well, this one, they're working on amendments to the Senate version to conform
Oh,
it to
okay,
the.
so this doesn't have amendments?
No, this does not.
Okay. House Bill 226 without amendments. Can I have a motion? Senator Reedy, do I have a second?
Second.
Senator Hayes, all in favor of House Bill 226? 10 to 0, thank you.
Okay. House Bill 278, if you look at the next, or we also have a concurrence to this bill coming up next, but this bill codifies the Longevity Ready Maryland Plan and requires the Secretary of Aging to lead implementation of the plan with the goals of building a longevity ecosystem, promoting economic opportunity, preparing residents to afford longevity, and optimizing health, wellness, and mobility. The House version has removed a duplicative amendment that said that the Secretary had to work with local area agencies on aging. There was another provision amended in by the House that they believe covers that item, so that was taken out to make sure that the bills conform with each other.
So this is amended.
This is not amended.
This is not
the
amended.
next one is the same.
Okay.
Sorry.
On House Bill 278, Senator Mounts, you have a question?
Yeah, just a quick question. Was there a cost on this?
I thought we had,
No, it's codifying existing policies and procedures.
we didn't have a Senate bill?
No, we do. The concurrence is next.
No, on this particular 278, we did not have a Senate bill?
No, we passed it.
Okay, is that what you were asking?
I was just fact checking because I was looking at some of the votes in the House, trying to figure out where
Okay.
those votes were. But
So he's
that-
asking, was there a cross-file? Yes, there was a cross-file.
Yes.
Senate Bill
113.
113.
Yeah, and I just wanted to verify there was no cost. It was just codifying existing programs.
Okay, so all in favor of House Bill 278? Oh, I'm sorry. You're right. I thought Senator Mounts was going to motion. He was going to ask a question. I need a motion on 278.
Move favorable.
Senator Kramer, do I have a second? Senator Giles has seconded. Thank you. All in favor of House Bill 278? I'm going to say unanimous vote, but Senator Hayes stepped out. Okay. You check with him. Okay, House Bill 746.
Okay, before that, we do have a concurrence for Senate Bill 113, which is the cross-file of House Bill 278 that we just passed in the same posture as the Senate bill as amended by the House. So the appropriate motion would be to concur in the House's amendments.
I have a motion to concur with the House amendments. Anybody?
Yes, ma'am.
Kramer
Yeah.
and Senator Guile. Thank you. All in favor with the concurrence? Unanimous vote. Thank you.
House Bill 746 is another bill where the next item will be the concurrence of the Senate bill as it was amended in the House. So the House bill prohibits the Maryland Department of Health from imposing a co-payment, co-insurance, or deductible requirement on coverage for services provided in accordance with the collaborative care model. Certain insurers, nonprofit health service plans, and health maintenance organizations must provide coverage for services in accordance with the collaborative care model. The bill further requires the Maryland Health Care Commission to conduct a study on the impact of eliminating health insurance cost sharing for services and report for collaborative care model services and report its findings and recommendations. The Senate passed the cross-file without any amendments, and the House amendment, the bill had originally removed cost sharing for the private insurance carriers, but this has instead put that back in and instead made a study on whether to eliminate cost sharing for those carriers. So the appropriate motion would be to move favorable on the House bill.
Motion favorable on House Bill 746.
Move favorable.
Senator Kramer, do I have a second? Senator Hayes, all in favor of House Bill 746? Okay, thank you.
Okay, and the last item is a concurrence to Senate Bill 428, which is the cross-file for House Bill 746, and the House amended the Senate bill to be identical to the House version.
No, it's on the blue,
Sorry.
list.
So we can move favorable on that.
That's just a motion favorable? Okay. Motion
To concur,
favorable.
I guess? Yeah.
Motion to concurrence with Senate Bill 428. Senator Guile, Senator Jackson, everybody in favor of the concurrence? Thank you. Okay. Thank you. Lisa? Now we have Amber.
Right, we're moving to the yellow sheet for voting list 18. The first bill is Senate Bill 564, the Office of the Attorney General Data Protection, which establishes the Division of Data Protection within the Office of the Attorney General to enforce specifically Maryland's Online Data Privacy Act, also known as MODPA, and the Maryland Age Appropriate Design Code Act. The new division must include a full-time chief counsel of data protection and other specified staff, including attorney generals, investigators, and administrators. The bill also establishes the Maryland Data Privacy Implementation and Innovation Work Group staffed by the Attorney General's Office to study Maryland's consumer data privacy framework and evaluate implementation issues and make recommendations for legislative or policy changes for technical clarifications. The work group must report its findings by January 1, 2027. You do have a reprint. It's just for one technical amendment at the top of page 2 to strike out an erroneous cross-reference that wasn't supposed to be in the bill. There's no opposition at the committee hearing.
Hey, Amber, real quickly, Senator Hester asked to be added as a co-sponsor.
Sure.
Thanks.
I'd like to be a co-sponsor also. Okay, other than,
There is an amendment on it, so it would be a movement favorable as amended.
thank you, Senator Guile. Is there a second? I'll second. Nobody else is going to? Okay, Senator Jackson. Does anybody else want to, well, let's take a vote on Senate Bill 564 as amended. Unanimous vote. Does anybody else want to be added as a co-sponsor?
Senator Lamb, did I see anyone else?
Okay, there we go. Okay. Okay.
Next on your list is Senate Bill 782, which as amended generally prohibits a person from recklessly or willfully and maliciously defacing, damaging, or destroying telecommunications infrastructure. A violation of the bill is a misdemeanor subject to a maximum penalty of 6 months incarceration and/or a $500 fine. The bill also provides greater specificity for the types of telecommunications equipment included under the definition for junk or scrap metal, and authorizes a junk dealer or scrap metal processor to accept an alternative form of documentary evidence from a seller to show that that seller has legal authority to sell the equipment. You do have a reprint in front of you. There are several amendments offered by the bill sponsor as negotiated with the relevant stakeholders and represent consensus amendments. On page 2, you'll see the added specificity to the types of telecommunications equipment that qualifies as junk or scrap metal. Page 3 strikes a number of provisions that the scrap and junk dealers testified were overly burdensome. The back of page 3 here has the language for the alternative documentation. And page 5 alters the penalty provisions.
Thanks, Senator Jackson. Do I have a second on the bill as amended?
I'll second.
Senator Kramer? Senator Mounts, you have a question?
Yes. Thank you, Madam Chair. For council, the way the bill, the provisions in the bill for the scrap metal, the entities that handle the scrap metal, are there liabilities that are created for those individuals?
Liabilities in what sense?
For accepting certain metals?
So that's
'Cause-
how, no, it removed those provisions and it allows them to accept from the seller either a bill of sale, a receipt, a letter, or of authorization or other documentary evidence so that to help cover the scrap or metal dealer saying that the person who sold this to me gave me this and I'm relying on it that they have authority to sell it.
And that's to address the opposition testimony?
Correct, and these were consensus amendments, so the opposition has been removed.
Okay, thank you.
Okay, we've had a motion and a second. All in favor of Senate Bill 782 as amended? It's a unanimous vote. Thank you.
Okay, and House Bill 1100 is next. It is the cross-file to Senate Bill 782. It did come over amended. There were additional amendments added so that this bill is now identical to the bill you just voted on, Senate Bill 782.
So can I have a motion also?
And
Senator
this would
Jackson,
be as amended.
And I'll second again.
Okay, Jackson and Kramer, same bill. All in favor of the House bill version? Okay, 10-0. Thank you. Okay.
Next is Senate Bill 849, which as amended conforms the bill to its House cross-file. In general, the bill establishes consumer protections related to agricultural equipment by establishing a consumer process for providing written notice to report a nonconformity, defect, or condition occurring in the equipment. The bill also establishes numerous procedures for remedying a nonconformity, defect, or condition. Any consumer who suffers a loss because of a violation of a provision in the bill may bring a civil action to enforce the provision. In addition, any other remedies that may be available, a manufacturer, factory branch, or its agent or authorized distributor who has found to have acted in bad faith, the court may award damages up to $5,000. The bill only applies to agricultural equipment sold on or after January 1, 2026. Violation of the bill is an unfair, abusive, or deceptive trade practice.
Can we do both bills together?
You can. It would be favorable as amended for 849 and just a favorable for the House bill. No amendments.
Favorable as amended on Senate Bill 849, and is favorable on House Bill 1395.
Thank you, Senator Kramer, and Senator Mounts just seconded. All in favor of these two bills? Thank you. Unanimous vote. Okay.
I'm looking out for our
Next, Senate Bill 867, as amended, makes various changes to the membership, purpose, staffing, and responsibilities of the Maryland Aerospace and Technology Commission within the Department of Commerce. The bill also authorizes the commission to provide grants to eligible entities for the development of emerging aerospace-related technologies, research, workforce training, and the development of certain local infrastructure improvements. You do have a reprint. The amendments are offered by the bill sponsor, make various changes to the membership, striking some of the added members from the commission at pages 3 and 4. And then page 6 expands entities to which the staff shall consult and connect to the commission. And then at the back page, it strikes language that would have added a mandated appropriation.
I will second.
Okay, who's voting?
Senator
Senator
Washington.
Washington, imagine that. Senator Washington, Senator Kramer. All in favor of Senate Bill 867 as amended? It's a unanimous vote, thank you. Okay,
And next you have House Bill 118. It is, while not a cross file, it is identical to Senate Bill 261, which passed the Senate unanimously earlier this session. In general, the bill excludes payroll processors from the definition of money transmitter and from the requirement to get a license under the Money Transmission Act if the payroll processor meets certain requirements. There are no amendments. There is no opposition.
Yeah. How is it possible to have two identical bills and then not cross-file?
If the sponsor in the House and the sponsor in the Senate don't realize that they both are asking for the same bill, or advocates have approached two sponsors and they don't know, identical bills can get dropped in the House and the Senate, but never cross-filed if the sponsors don't agree.
Okay. Oh, thank you for that.
Senator, I had the Senate bill and I had no idea that they had approached someone in the House, so it's the first time that's happened to me. Thank you for the question.
How many years is that? How many years?
20,
20 years.
first time that's happened. Do I have a motion then on House Bill 118? Not amended, right?
No, no amendments.
No amendments, so on House Bill 118, do I have a motion? Okay, Senator Mounts and Senator Kramer, all in favor of House Bill 118. Unanimous vote, I think. Senator Jackson, you okay? Oh, yes. Thank you.
House Bill 339, as amended, is identical to Senate Bill 396 as it passed the Senate unanimously earlier this session. In general, the bill modifies the pay schedule of the full-time chief inspector employed by the Anne Arundel County Board of License Commissioners from the pay schedule NR 5 to pay schedule NR 12. There is one amendment to the bill, which is aligns it with its Senate cross file and modifies the pay scale from 15 to 12. There's no physical impact, and there was no opposition at the hearing.
Okay, I have a motion. Senator Kyle? And do I have a second?
I'll second.
Senator Kramer, thank you. All in favor of House Bill 339? Pardon me?
Abstain.
Okay. You know, you're like recusing yourself, abstaining? I mean, typically you need to have a reason to do that. I'm not quite sure. It's our county and you serve on the delegation.
I abstained on the consent.
I know you did. I had a question when you did it then. I didn't ask it.
No.
But technically, the ethics can ask you to fill out a form when you abstain or recuse. I'm just mentioning it. We don't need your vote, but you typically should have a reason to do that. You can vote against it because you don't want to give somebody a raise, but
Well, I'll vote against it.
okay, so let's do a roll call on House Bill 339.
House Bill 339, favorable with amendment. Vice Chair Hayes.
Yeah.
Yes. Senator Kramer.
Yeah.
Yes. Senator Reedy.
Yes.
Yes. Senator Ellis.
Yes.
Yes. Senator Mounts.
Yes.
Yes. Senator Jackson.
Yes.
Yes. Senator Washington. Yes. Senator Lamb.
No.
No, I did. Senator Guile. Got excited. Senator Guile is a yes.
9-1.
Madam Chair.
Not yet, yes. Okay, House Bill 512.
House Bill 512, as amended, is identical to Senate Bill 401 as it passed the Senate 41-1 earlier this session. In general, the bill increases the annual salaries of the chair, the members, and any part-time inspectors of the Anne Arundel County Board of License Commissioner. The bill also requires that salaries include any cost of living increases available to the non-represented county employees. There is one technical amendment on the bill. The bills were not amended. They were attempted to be amended identically, but the word non-represented was put in two different locations, so this just moves it to the more appropriate location, and the bills will be aligned.
May I have a motion for 512 as amended? Senator Guile?
Yeah.
And Senator Hayes? Just trying to move it along. Okay, let's do a roll call on House Bill 512.
House Bill 512, favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yeah.
Yes. Senator Reedy?
Yes.
Yes. Senator Ellis?
Yes.
Yes. Senator Mounts? Yes. Senator Jackson?
41-1
Yes. Senator Washington?
on the floor.
Yes. Senator Guile?
Yes.
Yes. Senator Lamb? Yes. Madam Chair?
Yes, 10 to 0. Thank you. Last bill, House Bill 1473.
Move favorable.
It is identical to Senate Bill 770, which passed the Senate unanimously earlier this session.
There it is.
It establishes Maryland's future board.
So Senator Kramer moved favorable. Do I have a second? Who said second? Senator Jackson. All in favor of House Bill 1473 that's identical to the Senate bill? Unanimous vote. Okay. That ends the voting session for today. We're going to have a lot more bills on Tuesday.